Hello, and welcome to the Center for American Progress event, Shining a Light on Older Women. My name is Emily G., and I'm Senior Vice President for the Inclusive Growth Department at CAP. This month, May, is Older Americans Month, and we are excited to have you join us for this important conversation on older women, the unique challenges they face, and policy solutions to support older women's employment and economic security. Over the past 2 decades, older women have become a large and growing share of the labor force and will continue to be that way. According to the US Bureau of Labor Statistics, more than 60% of the growth in the labor force this decade will come from workers age 65 and over. The aging population is also dominantly female, and women currently make up the majority of US adults over age 55. Unfortunately, despite these gains, during the height of the COVID-19 pandemic, older women experienced larger drops in employment as compared with younger women or with men of any age. But according to more recent data, these older women are now benefiting from robust job growth, thanks in part to the Biden administration's economic investments. Data also points to continued growth in older women's employment over the next decade. In order to sustain this growth, we need policy solutions that will provide older women's employment, which is something that CAP has been engaged with for many, many years. The CAP Women's Initiative recently released a column talking about how paid leave is an essential investment in retirement security, especially for older women. And today, we released a fact sheet on older women in the labor market, which outlines how older women have become and will continue to be a growing force in the labor market, and describes some of these challenges they face in maintaining labor force attachment. For example, the gender wage gap grows with age and is larger for people of color. Women age 55 and over experience the widest gender pay gap, with the largest pay gaps occurring for older African-American women and Latinas. In addition, women ages 55 to 64 who were not in the labor force, 1 in 5 of these women reported it was because they were full-time caregivers. CAP's policy agenda aims to bolster support for older women in all facets of their lives, and it includes policy solutions like comprehensive paid leave, caregiver support, workplace accommodations, pay equity, job quality, economic mobility, and protections against discrimination in the workforce. But all too often, policy reforms don't reach the people most in need. It is vital to have a conversation about equity, and that's why I'm so pleased that CAP's Women's Initiative is hosting this discussion today. Today, we are honored to be joined by Representative Jan Schakowsky, who has represented Illinois' 9th Congressional District since 1998 and is a longtime champion of older women. Over the course of her career, Representative Schakowsky has also been a strong advocate for seniors on healthcare issues and has constantly fought to prevent the privatization of Social Security and Medicare and to make prescription drugs more affordable for everyone. She's also a leader in the passage of the Affordable Care Act, and she was responsible for several provisions that benefited older Americans, including initiatives to increase the number of healthcare providers. Representative Schakowsky's accomplishments are many, but one that stands out is her leadership in the creation of the Seniors Task Force in the 111th Congress. She continues to serve as co-chair in this Congress for now what's called the Task Force on Aging and Families. Representative Schakowsky, welcome, and thank you so much for being with us today.
Well, thank you. I just really appreciate all of your work and all the people that are listening today and involved in this. You know, aging in the United States of America is no easy job. It is hard because there are so many challenges. Over 55% of aging people right now are women right now, so we are the majority. But we also know that we live longer. I guess part of that is good news, but it also means that we live poorer. And the reason for living poorer is that what we have found is that because Social Security, and I just came from a wonderful press conference in support of Social Security 2100, which is the chief sponsor is John Larson, and a number of us are co-sponsors that would improve Social Security, which of course has been around since right after the Depression in under the Roosevelt administration is the biggest treasure. And right now in the United States of America, over half of Americans rely on Social Security for at least half of their income, because we have lost so many pensions. People don't have savings anymore. It's all about Social Security. And 25% of Americans right now, it's probably even more because this is slightly older data, rely on Social Security for all of their income. And believe you me, the Social Security benefits that people get are very, very modest, sometimes not more than $13,000, $1,300 a month. So it's not a lot of money. Anyway, so what we need to talk about is what are we going to do to protect not only Social Security, but all of the programs. Social Security is not a benefit. It is an earned income because people pay for it through every paycheck that they have. I wanted to tell you my history. I've worked as the director of the Illinois State Council of Senior Citizens in the 80s. So this has been really my life's priority in the Congress, healthcare, but also working to make sure that we protect older Americans. And as I've said before, women mostly are suffering. Men make a few $1,000s more on average than we do. Women are at about 78% of what men make, what men take home in Social Security. So I know that there are a lot of speakers today, but I want to tell you that this is also the largest voting group is older people, and they are feeling very vulnerable at this very moment. We've seen that the Republicans now are threatening to default, and the result of that would be that the Social Security benefits wouldn't go out. Social Security disability wouldn't happen. People like one of my constituents would not be able to pay the rent or put food on the table or pay for her pharmaceuticals. So I have been focusing not only on Social Security, but what we have seen, and I want to tell you some of the good things that have happened. In the Inflation Reduction Act, we saw that there was a cap now on the the pharmaceutical costs, so that no one on Medicare would have to pay more than $2,000 a year out of pocket. That sounds still like a lot of money, but you know, we have seen many of our older Americans have thousands of dollars in pharmaceutical costs. So also in that bill says that we're going to begin to negotiate with Big Pharma to lower those prices. But it also set a cap of $35 a month for insulin, which means that a lot of older Americans are going to be able to afford their life-saving insulin, which is so important for diabetes. But I'm telling you, we have in this richest country in the world, in the richest moment in history, I believe have to continue to fight against Big Pharma, against big corporations, against some of the insurance companies. We get calls in our office every single day from older Americans who are trying to figure out how they're supposed to navigate to get the health care they need. Medicare Advantage, which can be a disadvantage for many of our older Americans. It is not really real Medicare, it's private insurance. So there are a lot of obstacles and a lot of difficulties and a lot of hurdles that older Americans have to face right now. There's no reason for that. We should, I believe, have Medicare for all, universal health care for everyone, and we should make sure that the earned benefits of Social Security are made even more robust than they are. So we have a lot of work to do. It is true that I was helpful in the Obamacare and the Affordable Care Act. And one of the other things we did was look at nursing homes and, because sometimes that is an option that people need to take. And what we're seeing now is that private equity is getting involved, that nursing homes are not as safe as they should be. 200 million workers and residents of nursing homes died during the pandemic, the largest single group. So we have a lot of work to do to protect our older Americans. The reason that we are finding problems in what women earn in their Social Security, and I'll end with this, is because of the historic low wage that women earned compared to men, particularly women of color, and also because women have had to leave the workforce in order to do caregiving. So we have to help the workers in the care economy, and we certainly have to help the people who are doing home care. We need more home and community-based services. The President of the United States acknowledges that. We don't have it. So we are fighting with alongside the unions and seniors to make sure that aging in America is not as hard as it is, and that it really can be a time when the federal government and all our governments kick in to say, we're going to make sure that as we move toward the end of life, that all of our people are safe and sound. And if they want to work, that they can work. And if they can't work, we're going to make sure that the benefits are there, and the earned benefits too. Thank you. And now I am introducing, what is it? Maggie Jo, who is next to speak. Thank you.
Thank you so much, Congresswoman, both for your remarks this morning and for all the work you have done to benefit our country. Just another big thank you to everyone for joining us. I'm Maggie Jo Buchanan. I am our Senior Director of our Women's Initiative. But let's get right to the panel. So we have an impressive group of panelists who are here to discuss the multitudes of issues faced by older women, as well as to explore issues that will help improve their lives. First up, Denise Hyatt-Lindenmuth is the Executive Director of the National Women's Health Network and has worked in the Washington, D.C. area in both nonprofit and for-profit industries for nearly 30 years. Her nonprofit leadership roles include leading organizations such as Brain Injury Services and the American Cancer Society for the National Capital Region. Next, we have Naomi Stanhouse, who is a program consultant at the RRF Foundation for Aging, where she is responsible for RRF's work in the area of economic security and later life. She also created the Foundation's Organizational Capacity Building Program, which provides grants to enable nonprofits to improve their management and governance. And last but not least, Tracy Groninger is the Managing Director for Economic Security at Justice and Aging. Previously, she spent nearly 10 years as a senior staff attorney at the Federal Trade Commission in its Bureau of Consumer Protection, where she litigated a variety of cases to halt fraudulent and deceptive marketing practices. Thank you to all three of us for lending your time and brilliant expertise to this important and timely discussion, as well as another thank you to the audience for tuning in. I think now, honestly, building off both Emily and the representative's great remarks, let's start off by discussing some of the most important issues facing older women generally, just to sort of level set and get a lay of the land. And Denise, I hope you don't mind if I turn the first question to you. And we're hoping you can speak to some of the health issues that disproportionately affect older women, as well as how all these issues impact women's employment and financial security overall.
Perfect. Certainly happy to do that. So, once I heard the term silver tsunami, that was kind of like my aha moment and really understanding what we as a country are facing by way of healthcare and what our seniors, our baby boomers deserve in addition to, or in comparison to what they're actually getting. So if you talk about health issues, from the National Women's Health Network, we're looking at, for example, heart disease, where over 60 million women, about 44% in the US, are living with some form of heart disease. And that's according to the CDC, and it is the #1 killer of women. Osteoporosis is still at 27% and for women and about 6% for men over the age of 65. Women are more at risk of developing osteoporosis than men because of the hormonal changes that happen at menopause that affect bone density. Then, of course, there's breast cancer, based on current incidence rates at 12.9% of women born in the US today will develop cancer at some point during their lives. So in contrast, for men born in the US, the lifetime risk of breast cancer is just 0.13%. Whereas breast cancer is the likely common of cancers, is primarily a disease of older adults in the US, where the median age and diagnosis of breast cancer is 61 years. And at 41% of breast cancers are diagnosed in women at age 65 or older. But, still science is still skewing that we are seeing breast cancer earlier in women. And of course, the requirement or the suggestion that women be screened earlier at age 40 rather than 50 has recently come out. So then also we're looking at, for older adults, we're looking at stroke, and stroke is the third leading cause of death for women in the US. They have a lifetime risk at about 20 to 21% for ages 55 and older. Stroke is more likely to be the first manifestation of cardiovascular disease in women, whereas in men, coronary heart disease is more common. So the social context for women who experience stroke is very important. It's more important than perhaps for men. And the age and onset of stroke on average is 4 to 6 years older than men. Women are more likely to be widowed, unmarried, or living alone, and have a higher degree of disability in their activities than men at the time of stroke. And that's according to the American Heart Association. We also have diabetes. About 1 in 9 women in the US have had diabetes, especially type 2, which is more common in males than females. However, women do have more serious complications and greater risk of death. These complications often include heart disease, blindness, depression. Then there's Alzheimer's. 1 in about 9 adults over the age of 65, about 6.2 million people have Alzheimer's disease, and almost 2/3 are women. Scientists think that this is because women live longer and possibly have stronger immune systems compared to men, but more research, of course, is needed. Then we have falls. 1 out of 5 falls causes serious injuries such as broken bones or head injury. Depression. Depression is also a significant thing that we're seeing that is twice as many seniors or senior women are affected by depression than men. And then there's also loneliness, which I think the Surgeon General just talked about. It's distressing and causes, I guess, a lack of social connection and imposes a significant risk for individuals and their health and longevity. Loneliness and social isolation increase the risk for premature death by 26% and 29% respectively. More broadly, lacking social connection can increase the risk of premature death as much as smoking up to 50 cigarettes a day. That's in the Surgeon General's report, which I found absolutely amazing. So I hope that answers your question about what we see as far as health issues for aging women.
Yes, thank you so much. And switching gears somewhat, though very related, Naomi, what are you seeing as recovery continues from COVID when it comes to aging women and particularly their employment? We know there has been a very robust recovery, but what can we do to sustain? What can we do to improve on that?
Oh, Naomi, I think you're on mute still. Sorry about that. You already heard some data from Representative Schakowsky and also from Emily about older workers. And you also, right up on your website is this wonderful piece from Beth Almeida I see this morning on the 5 facts on older women in the labor market. So I won't go steal anybody else's thunder. I'll just add some additional points. First is sort of an overarching comment about older women and employment. First, everyone should be able to achieve a secure retirement. It's good for all people, older women, good for everybody, good for the economy. If people work into their late 60s and on, it shouldn't be for need, it should be by choice. For dignity is choice. And I think that overarching thought is something that we should keep in as we approach the issues of older women. Your level of savings is largely dependent on your employment history. Employment is the vehicle for savings through paying into and determining your level of Social Security and for contributing to 401ks. By context, leading up to the beginning of the pandemic, older women represented one of the fastest growing demographic groups in the US workforce. And the US Bureau of Labor Statistics forecasted that no other group of workers would see such increases in the decades ahead. But COVID and the pandemic had the greatest impact on lower income working women. As they left for caregiving, they were fearful to return to jobs like direct care, personal care, and teaching, and they couldn't work remotely for many of their jobs. So many just chose to retire or involuntarily retired rather than put themselves at personal risk. We are back to pre-pandemic rates, as you heard, thanks in part to the job growth. But the return might have been even higher if more women had not retired when their spouses retired early. It's still projected older women will become an increasing share in number of workers. You heard that both from Emily and from Jan. But one area no one touched on so far is the growing trend in the rise in part-time jobs and contingent or gig work, which generally means for older women, low-wage jobs. Women account for 2/3 of the part-time workforce, and many are older women. Although gig or contingent work has some advantages in terms of flexibility and fit with caregiving responsibilities, and as a means of supplementing income, there's less likelihood of having protections for safety and occupational health, or minimum wage and overtime protections, or eligibility for unemployment insurance benefits, and less access to retirement benefits. Part-time work and gig work should not be by default. Older women face physically demanding jobs like lifting, turning patients. They shouldn't be forced to stay in these jobs due to their inability to save for retirement. Older women are overrepresented among the working poor. Older non-white women are at the highest risk of being working poor. Older women aged 65 or older are nearly 30% at risk of being the working poor, and that compares to 15% for men. Older working women are the least likely among older workers to participate in a retirement plan. This is partly due to working in part-time jobs which don't provide retirement benefits. Women make up 2/3 of caregivers for adults, often limiting them to part-time work. If they can contribute to a retirement plan, they have typically earned less, lived longer, and thus are in jeopardy of depleting their retirement savings. Finally, I just want to call attention to something you will see when you get email after the presentations. Call attention to the Older Workers and Retirement Chart book that was created recently by the Schwartz Center for Economic Policy Analysis at the New School and the Economic Policy Institute. It's led by Teresa Ghilarducci, director and labor economist, and I call her the go-to on older workers. The chart book provides data on older workers by age, race, ethnicity, education, retirement security, retirement plan participation rates, and more. And it suggests several policy solutions. I urge you to use it to advocate for sound policy reform, and we can get into some of those reforms later.
Absolutely. Thank you so much. And, to actually draw some of those themes out, Denise, just looping back to you for a second, could you take a few minutes to speak to some of the intersectional issues that make different groups of women, including women of color, more likely to face those health disparities as well that contribute to all this as they age?
Well, I think, a lot of people have already spoken on some of these intersectionalities that impact it. Their caregiving responsibilities, we've kind of already touched on that. There's the whole process of weathering. I mean, people are getting older and they're getting tired, right? It's, biologically, it's just the erosion of health, particularly in Black and Brown communities, that occurs much earlier in life, right? Than it does in other communities. This is due to increased exposure to stressors, persistent prejudice in income and inequality that can trigger biological aging. So that's really one of the key intersectionalities. Then, of course, there's implicit bias and ageism. That's a given. Discrimination and poor health outcomes also for LGBTQ older Americans. LGBT people face health disparities due to stigma and discrimination and violence still to this day. So, that's one of the intersectionalities that we need to deal with. I think someone mentioned earlier, there's poverty. I mean, quite frankly, it still exists. Over 50 million people, or roughly 1 in 3 older adults age 65 and older, are economically insecure. Comorbidities in healthcare. That's something that older Americans are just going to be facing. And then there's, I say it's rural versus urban living. In rural communities, our elderly or our older population are not going to have healthcare access probably as easily, and I use that in air quotes, as our older Americans living in cities, but still there are going to be barriers to care there. So, I mean, those are the kind of like the 3 or 4 things that I'm seeing as far as intersectionalities with older Americans.
Thank you so much. And I apologize. I think I almost started speaking on mute myself. So I apologize if that confused anyone. Okay, great. Thank you so much. And Tracy, I feel like I introduced you last, and now we're getting to you as the last question to turn to you in this section. But, of all the amazing work that you do at your organization, kind of tying all this together, can you speak to, just some of the top issues of how intersectionality can make it more difficult for older women of color to maintain their economic security as they enter retirement age, just drawing on all the great themes that, unfortunate statistics that Denise and Naomi have spoken to?
Yeah, and I think that we've touched on these things, but I think that it's really important to highlight how all of these different kinds of kind of identities come together over the course of a person's lifetime. And so we're talking about the intersectionality of your sex, your gender, your race, your age, all of these things over the course of your life. And, that pay gap starts early and it continues for decades. And that means, when we're talking about, to Naomi's point about Social Security, they're looking at 35 years of your work history. And if you've had to take time out of the workforce for caregiving, if you've had to, take very low wage jobs at certain points in your life because of various forms of discrimination, we know that people of color are more likely to experience unemployment. That all affects when you get to retirement age, how much income and savings you have available. And for people of color, older women of color, they're twice as likely to age into poverty as white older women. And it all comes together. And I think that, really highlighting another piece of this is, talking about this pay gap and the way that we structure work. There's some inherent discrimination in there. Women's work generally, as we sometimes call it, is undervalued. There was an AARP report that just came out that highlighted that there's about $600 billion in caregiving that happens. And it's primarily women who are providing this caregiving, and it's primarily caregiving, I think, that it's undervalued. And you think of it in terms of healthcare and the home health aides, people who are providing really important services, who are undervalued, just clearly undervalued. People who are working as teachers, for example, there are all these in service roles. These are all roles where we see really low wages compared to kind of the services that are actually being provided. And I think that that's something that is important to highlight when we look at, why do we have these kind of systems in place in terms of Social Security and in terms of supplemental security income that are supposed to kind of work towards having a little more equity in terms of how much income people have in retirement. We have to make up for some of that structural inequity in some way. And so I think that, that's one reason that we're talking about this and really reiterating the importance of these programs, because women are facing these problems over the course of their entire career history.
No, thank you so much. And I think that is honestly the perfect segue into sort of the policy specific questions that we're hoping to get at today. Naomi, I am going to kick it to you to start this section. What do you see, especially given your sort of national lens on all of this, what do you see as some of the most promising strategies to promote economic security in later life? And how do those initiatives, those strategies specifically impact older women?
Well, first is I'd promote the use of the elder index to determine the real needs of older people and older women and apply that to retirement security and safety net policies. If you don't know about it, the elder index is developed and maintained by the University of Massachusetts at Boston. And it's based on the household as a unit of analysis and measurement. And it's geographic specific and includes the costs for housing, transportation, utilities, healthcare, and food. So it's a measure based on actual expenses encountered by older people, as opposed to the federal poverty level, which we all know is woefully obsolete. And the even the supplemental measure is not really adequate for measuring older people. So with the reauthorization of the Older Americans Act coming up in 2024, there's a good opportunity to embed the elder index into policy at that point, and actually to put a greater focus on economic security and the issues of older women. There's a great opportunity, and advocates need to get on that. Second, I'd advocate for establishment within the Department of Labor of the Older Workers Bureau. This legislation has been introduced by Don Beyer of Virginia. It'll create pathways to higher paying jobs, create multi-sector collaborations, private-public partnerships, develop incentives to create supplemental savings and investment tools, and provide financial education for workers to support their current and future needs. Third, we know that older women generally have less financial capability. And so it's really important. There are some promising financial capability models out there. For example, the Pension Rights Center's Older Women's Initiative is focusing on spousal protections for pension benefits and educating people on the Qualified Domestic Relations Order, which I knew nothing about. There's a gem of a program in St. Louis out of an organization called LifeWise St. Louis. It operates the Senior Resiliency Fund. It educates and provides support for the lowest income Black older women in the lowest income community in St. Louis. And it is getting older women who never banked with incentives for a match savings to bank for the first time, and it's really working. There's a model that uses pro bono financial planners as coaches for new widows, but we need to find these gems, test them, and find a way to sustain them and bring them to scale. Finally, I'd like to call attention to the National Resource Center on Women and Retirement that's operated by WISER, the Women's Institute for a Secure Retirement. And within it is the Financial Caregiving Hub. It's a one-stop clearinghouse on finances for caregivers and care recipients, and we know how many of those caregivers are older women. Financial education, to some degree, can increase financial stability. I think I'll leave the rest of the policy solutions to others.
Thank you. No, that was incredibly helpful. So Denise, looking at healthcare specifically, what trends do you see in healthcare delivery for aging women? You've spoken on a few of these, especially with barriers to care. But just if you wouldn't mind elaborating a little more, what do you see as the biggest or most severe barriers to improving the outcomes for older women?
Yeah, so I don't want to, reiterate really what has already kind of been touched on and said, particularly by the representative. I really think she hit it spot on. But, there's the ever shrinking access to Medicare and Affordable Care Act for older folks, the Medicare Advantage piece, Medicare Advantage rates are rapidly increasing. At the same time, some older Americans are switching from Medicare Advantage to traditional Medicare due to high out-of-pocket costs. So, those are one of the things that we're looking at. Or I could say healthcare deserts, are still going to be a big challenge. Older Americans are less mobile, less able to drive, et cetera. So assisted living facilities are at higher risk for closure. And as of 2022, 400 nursing homes were projected to close. So, making sure that our elderly have that kind of care level to access is still going to be a critical need. In some areas, you're going to see workforce shortages, aging workforce and taking care of an aging population. In some of our elder care facilities, those workers are aging themselves. So, we need to kind of figure out how to infuse some, incentivize some younger healthcare workers to be able to help take care of this population. And then again, of course, there's going to be the implicit bias in ageism, which is going to be a big challenge because it's really trying to, it's something that we're going to be dealing with, and we're always going to constantly be dealing with and try to fix and amend.
Thank you. And I don't think you're repeating anything that we're hitting on a bunch of times. I think it's just because it's so important. So thank you so much. That was so helpful. Tracy, turning to you, and some of the discrimination, realities that I think Denise just spoke to. What are some ways that you see that we could improve outcomes for older women who have been harmed or are currently being harmed by inequitable systems or, again, overt discrimination?
Yeah, I think there are different things that you can do that affect maybe different stages of women's lives. And so one thing I think is just higher wages in general. Low wages at the beginning of your career continue into the middle and to the end of your career. So I think like lifting kind of the wages for people in general is one important piece of the puzzle. And then that includes kind of more equitable jobs so that we are paying people for the value that they are actually providing and not kind of suppressing women's salaries because of gender discrimination and sex discrimination. And then I think in addition, we can have legislation that makes it easier for people to file for age discrimination complaints. So if they're seeing age discrimination, making it, easier for them to fight against that so that that's something that they can respond to as it's happening. And then kind of thinking about, Social Security, and we talked about this, strengthening the program so that in some ways, we are making up for some of those structural inequities in the way that we structure our Social Security program. And so expanding benefits so that the floor is an actual economically secure place and you're not giving people sub-poverty level incomes simply because of the discrimination and the structural inequities that they've experienced previously in their lives. And this would include strengthening the Supplemental Security Income System, SSI, again, so that low-wage workers are not seeing sub-poverty income when they are older adults. And then generally, I think creating more affordable housing, I'm just going to throw that out there as another piece, because housing is a really important piece of this puzzle, and it is a very high expense for older adults, especially as there are more renters, as housing costs are going up, and as it's becoming more difficult to find and stay in homes. So I think just thinking about housing is another piece that we have to consider generally. Oh, and I hope I said something about caregiving, because paid leave is also key. Oh, I think you might be muted, Maggie.
See, I thought I was gonna say myself, but I didn't. But no, all I was saying is I actually think that's perfect. I was just gonna ask you to follow up on how we could better meet the needs. You've already talked about a few, mentioning paid leave, but of how we can better meet the needs of workers who need to take time off and flex their schedules to care for their families, and are still able to meet their economic needs as they age.
Yeah, I think in addition to paid leave, another piece that we could incorporate is providing kind of caregiver credits for times when people do take off to care for children or older relatives, parents, spouses. And this is, again, a way that we can use a current program, Social Security, to force some of that equity into our system. So this caregiver credit would just give credit to people who are not officially in the workforce, so may not be paid, a salary, but are still providing really important care that is critical to our society maintaining itself and to all of the various structures that we depend on. This would give them additional income that would otherwise not be counted and would lead to them having lower Social Security benefits when they retire.
Thank you so much. Okay, so it's very exciting. We are getting a ton of audience questions. But before we go into those, Naomi, I'm just hoping we'll close out this section with you. We've really, talked on a lot of these themes, especially as it relates to the social safety net, but I know you have written pretty extensively on the topic. So could you just underscore for us why such programs are so critical for aging women?
Just to put some context around the need for the social safety net, especially for older women. We already talked about the disparities that older women bring into old age. And if you have a lifetime of accumulated disparities, it means that closing the wealth gap, which is often the phrase that's used, is not really very feasible for low-income, high-risk older women. So then you have to turn to, what are our default safety net programs and how can we make those stronger? For one, too often benefits for older women are left on the table due to lack of awareness, complexities in applying, lack of an adequate supply and funding for navigators, and the digital divide that creates even greater access barriers as more and more applications, et cetera, have to be done online. And for some older people, they only have a cell phone. If you've tried to fill out a 24 application on a cell phone, good luck. Half of eligible older people don't enroll in SNAP. It's the same for the Medicare savings programs. 1/3 of those who are eligible for supplemental security income don't know about it. So we need policies that mandate and fund education and outreach about benefits, that provide support for navigators, expedite the processing of applications, create less hoops for applying, and make benefits accessible and timely. We talked about modernizing the social insurance programs. Those are separate from safety net. So we need to learn what some things worked well during the pandemic, and we ought to be continuing them. We should advocate for continuation of waivers that discounted asset limits for programs like SSI and reduce redetermination requirements for benefits like SNAP. Our report is just about to come out from the National Academy of Social Insurance. They had a task force on COVID-19 that provides lessons learned from the pandemic and applies them to a series of policy recommendations to improve our social insurance system. Look for it. It's coming out, I believe, this week. And it has an accompanying advocate toolkit that can be used with good data behind these issues. We talked to Tracy about adjusting the floor further for people, especially for older women on Social Security. And I think I can stop there. That's enough to think about.
For my panelists, we might go to a round robin question just to wrap us up, but we are honestly getting so many great questions from the audience. I want to jump in and get to some of those first. So this first one, please, anyone feel free to jump in. Multiple people jump in, so free for all. But the first question, many of the issues discussed also affect older women around the world. There are efforts at the United Nations to come up with an international legal instrument to protect the rights of older persons. Do you think viewing older persons from the perspective of having human rights, much like persons with disabilities, for example, if governments were to do so, would they be more likely to pay attention to violations against older people and how to best address them?
That might work, but I have a different perspective on that. There's a really Yeah, there's a very good thought piece put out by, shout out to Julie Miller at AARP in the Thought Leadership Department. She did a piece on women called Women Aged 50 Plus, an Irrefutable Engine Powering the Global Longevity Economy. And it emphasizes the contributions of older women. So instead of speaking about seniors and silver tsunamis, if we speak about the contributions that older people can make, and through paid work, caregiving, and spending, the population of women can make significant increasing contributions. And I think if we focus on that, we might get a little more attention, in a self-serving way to how we can help older women contribute even more. It's a flip side of that.
Yeah, I agree with that. And I think that it doesn't hurt to think about this in terms of human rights. And I think looking at some of the systems and the ways that they've developed over time does highlight how, women sometimes are dehumanized or not valued. And I think acknowledging that history and acknowledging how that works all over the world is a strong position to come from, because then you can see more clearly how some of these problems develop. And I think that, we sometimes think, and maybe it's just us in our wonk world, that it's so obvious and clear that this discrimination exists and that it's not fair and that there's all this inequity that we need to deal with. And I think sometimes people lose sight of, the lack of understanding about how inequitable and how unfair that is, and why it is important in terms of human rights for this to be addressed.
Thank you so much. Denise, did you want to jump in? We can also jump to next questions, but didn't want to leave anybody out.
Oh, no, hey, I think what Naomi and Tracy said are fantastic and spot on. I would love, maybe there's some kind of hybrid between what Naomi proposed and what the UN is actually doing, to really raise this issue. So nothing to add there, just support it.
Great, thank you. Okay, so again, this is for any of our fabulous panelists, but in addition to Naomi has mentioned some of the great organizations doing work, and of course, in addition to Tracy and Denise's own organizations, especially on the ground, what organizations do you see doing a good job of mobilizing older women to advocate for policy change needed? I think, we've talked a little bit about the importance of hearing directly from, older women about their experiences. And since, as the representative said, older women vote in large numbers and so should be taken seriously as constituents.
That's a very good question, because, one of the solutions that I would have raised, if there's a little more time, is that elevating the voices of older women and engaging them, that's us, me, in advocating for public policy and public-private collaborations to address the needs of older workers is one of the probably most effective strategies we could have. And I wonder, where are the older women advocates? National Council on Aging and Wiser just issued this Speak Out report that is a really great piece on, has 2 national surveys of women aged 25 and older, and all the policies. There were like 90% agreement from women 25 and over up to in their 70s about various policies that could be in place that would help all women across the lifespan, and thus older women into retirement. So I think we'll see more movement around that. But right now, I don't really see, honestly, a strong advocacy network for older women. Maybe Tracy, do you?
Yeah, I was going to say, I definitely look more at the federal side. I think that for more local grassroots action, it's effective. We maybe don't know as much about it from where we're sitting, but I know that, in terms of what we tell people on the ground to do, it doesn't take as much power as people think to reach out to your members of Congress to highlight the issues that you think are important. I think people assume that there's, just so much that their members of Congress don't have time to listen to their, thoughts or what they think is important. And I think that's untrue. I think that if a small group of women come together and prioritize certain issues, reach out to their members of Congress, raise those issues up for them, it does change the importance of that issue in DC. And it does provide a really important lens for members of Congress to look through in terms of what things they support and what issues they bring to the floor. And so I guess I'm saying that to say, you know, if you're not seeing something in your area, you can create some of that yourself. Like some of that is you coming together with your connections and your friends and your family and highlighting those issues for your local members of Congress, state and federal.
That's true on two accounts. First of all, in the caregiving arena, we've seen that happening. At least 10 states have these caregiving coalitions, a lot driven by older women that are building on the RAISE Act, and on the administration's call to action around caregiving. So we're seeing that. We also see, and we see it from a funder's perspective, the power of storytelling, because Congress people really respond to stories. And and on the caregiving side, the quote that Rosalind Carter always had, you're going to be a caregiver or you're going to be a receiver of caregiving services, that resonates with almost everyone at a personal level. So storytelling is really pretty important.
If I could just jump in real quick right here, we realize that this is a powerful constituency, if you will, in this country, and are looking to build on the success that the network has had over the past 50 years to galvanize this group so that we can see change. As you can imagine, it is not something you do overnight. And it is something that we are seriously looking at building a larger coalition around so that we can address some of these issues. And you could just see, as you know, resulting of today's discussion, it's a huge issue, right? So we really have to make sure that we are going to be laser focused on what we're doing so that we can affect some level of change. You know, there's nothing worse than that shotgun approach and getting nothing, right? But you will hit something, but we really want to be laser focused and taking on some of these huge issues, and it's needed. So we see it.
Thank you so much. So next up, we actually have a question from the Washington Post. I open this to any of the panelists to take first. I'd love to hear from all of you. But do you feel enough focus is placed on employment discrimination for older women?
Short answer, no.
Yeah, agree. No, and I think women, feel it more. I think that we see older women's salaries generally are lower, and the effects of kind of that discrimination is significant. And yeah, I don't think so.
I kind of agree with Naomi and Tracy, and probably have stories to share from our constituents, but yeah, I agree.
Yeah, I mean, proving age discrimination is one of the hardest things. Those are the greatest number of cases before the EEOC. We had a setback on that in terms of the proof of age discrimination, which we need to turn to. We also have discrimination at the application stage, and that's not really addressed. There is a bill in Congress now about looking at age discrimination in the application stage. Women show greater discrimination and greater sense of discrimination and less confidence in applying because of the discrimination aspects. So lots to be done in that area.
Great. And actually building on that, Naomi, we have a follow-up of what we think would be the most effective, what could be done to curb employment discrimination for older women. And again, for any and all of our panelists.
I think following up on what Naomi was saying, there's legislation to make it easier for people to file age discrimination complaints, the Protecting Older Workers Against Discrimination Act. And I think that's important just to kind of create even the ability to file these claims in the first place. And then I think, having these conversations and really pressing for employers to also be responsible for this and kind of putting a lot of, shining a lot of light on corporate practices and how people even make decisions about hiring. Some states have rules around whether you can ask someone's age or not, others don't. There's just different changes that people could make to kind of create at least some kind of standards in terms of what people should expect and how people will be treated in the workplace and how they will be interviewed and hired, and even, you know, how resumes will be reviewed, all of that. I think we just have to really talk about all of those issues.
Okay, great. So we only have a few minutes left, and I just really want to give each of our panelists, and thank you so much for all the engagement from the audience. It's wonderful to see. One last question for anything we didn't get to, policy, research, anything, for each of you, let's just go around once more to make sure we cover anything before we close out here in a few minutes. And so why don't we can go alphabetical by first name, which I think brings us to Denise.
Thank you, Maggie. Could you repeat what we're doing? We're just closing out, or?
Yeah, we're just closing out. I just want to make sure to give all y'all just a little bit of time. If we didn't touch on anything important, to basically to just let the audience know.
Oh, I see. Okay, so I guess for our perspective, we really want to make sure that communities, that Congress, that the administration, and all the federal agencies that support healthcare are really taking into consideration our older adults, particularly also when it comes to studies and looking at how drugs affect older adults, particularly older adults of color. We want to make sure that everyone is equitably included, but also in this process to look at older adults and to be supported by the community. Okay, to make sure that we are providing housing for our low income older adults, to make sure that we're providing, the right medical services so that no one is lacking. We want to make sure that, when it comes to the issue of chronic diseases, that people are managing them effectively, and, with the new issue of loneliness, so that we are, embracing our older adults as a community, which would lend to hopefully a better health outcome.
Thank you so much. Naomi, I believe you're next.
Yeah, just two closing comments. First of all, could we imagine the power of women across generations coming together to advocate for the policies we've talked about today? There's such a big tent, and we need to get in it. So that's the first. And just a comment that I applaud the Center for American Progress for taking an inclusive approach to bring into its women's initiative and older women's lens. As we know, women are a large and becoming even larger portion of the U.S. labor force, and to recognize that older women face particular retirement security challenges, especially older women of color. But I submit that often older women are excluded from policy considerations due to our implicit and explicit gender and age bias. So I hope we'll examine that and we'll be open to this greater inclusion.
Absolutely. Thank you so much. All right, Tracy, I think you're closing us out.
I think I would just add that I love it and I hear it, and I just want to reiterate to remember kind of the equity piece, looking at women of color, LGBTQ women with disabilities. Like there are communities that we can center in terms of how we're trying to address and fix some of these structural problems. And I think the more that we remember and center equity as a goal, the more people we are going to benefit, and the more we're going to affect change that is long lasting and that actually creates the change that we want to see. And I will keep encouraging people to reach out to their members of Congress, especially about things like Social Security, because I care.
Oh, thank you so much. Well, thank you so much. I think we are right on time, which is amazing. But thank you so much to our panelists. Thank you so much to the Congressman, to Emily, and of course to the audience for joining us. As we mentioned, we'll be sending a follow-up email to all who RSVP'd with some resources. So I hope everyone has a great rest of their Tuesday, and thank you so much again.